Hello, everyone. It's 2 o'clock, and I just want to welcome you to our continuing series of panel discussions on industry trends and employment opportunities. Our focus today is on a sector of our economy that is part of all of our lives, and of course, that is healthcare. Industry leaders say to continue to thrive, the healthcare industry needs a workforce with the right skills. I'm Rob McClendon, and I'll be leading today's discussion with a group of panelists I think you will find both interesting and insightful. But before I do introduce them, I do want to take a moment to thank the Masonic Charity Foundation of Oklahoma. Their generous contribution of $200,000 has to date provided 70 scholarships for the nurse refresher course that helps people return to the healthcare profession, which benefits all of us. Now, on to today's panelists. Representing the Oklahoma Nurses Association is Jane Nelson, their Chief Executive Officer. Jane says her professional bliss comes from working with association members on issues that make a difference in the lives of Oklahoma nurses. Now, Patty Davis is the president of the Oklahoma Hospital Association. Patty has experience in both small rural hospitals and large urban medical centers, as well as serving in multiple positions for the OHA before being named to their top spot in 2018. Joe Aiken is Vice President of Human Resources for Stillwater Medical Center. Stillwater Medical is a not-for-profit community health system powered by nearly 2,000 employees and 150 plus physicians and advanced practice providers representing more than 40 specialties. And then our final panelist today is Laura Morris. She is the Health Careers Education State Manager for the Oklahoma system. Now, Laura works with teachers across the state to help maintain standards and identify resources. A big thanks to everyone for being there and taking the time to be on this panel. I appreciate it. Now, I'd like to begin with the same question for all our panelists, but before we get into the nitty-gritty, and it's this: why did you choose to work in healthcare, and why should others too? And Jane, I think there's no better place to start than with you. You represent all those nurses. Why work in healthcare?
Well, for the first part, I want to be clear, I'm not a nurse. So I'm an association professional, and I found a passion working in healthcare with nurses. My mother was a physician, and growing up was the health commissioner for the county I grew up in. And so with that, she worked with nurses. They were a huge influence. And then her choice of careers was also a huge impact on me. And I think that's why I found my passion working here. But for the most part, we need healthcare professionals. They always have a job.
Absolutely. And Patty, how did you become involved in healthcare?
I say I did not choose healthcare. Healthcare chose me. It is a real serendipitous story. I graduated from OU with a degree in political science, had to move back to my hometown, and one of my jobs out of college was a fraud investigator for the Inspector General. And we did Medicare and Medicaid fraud audits, and I was recruited to my small town hospital to run the business office, and then later became the administrator of the hospital. And that's where I have been since 1986. I've been in healthcare, and I've been extraordinarily blessed. I've enjoyed it. It's a tremendous learning opportunity, and I mean every single day you learn something in healthcare, and I am delighted that I was chosen for this profession because I think it's a perfect fit for me.
Absolutely. Now, Joe, I know you've had a really varied career, but the similar question to you: why healthcare now?
Well, you know, it's interesting because, as you mentioned, I had a varied career. I started working at a local company called Kicker. I put together their international department. After a few years of that, I went and took over their marketing department. Following that, I went into dental, stayed in there for a little while, recently moved to software. And each step along the way, I had no experience in the industry that I was going into. So why not healthcare next? And actually, it was really interesting for me because my mother, who lived in Stillwater as well, she's a volunteer at the hospital. She has more volunteer hours than anybody else in the books to this date. And she just absolutely loved what this organization did for the community. That's why she contributed so much of her time. And I got to a point in my life where I realized, you know, all these things, there's only one common bond that bonded all those things that I had done together, and that was people. And it took me all this time to realize that really where I wanted to be was in a position that I could make a difference and have an impact, especially focused on people and taking care of them. And this opened up, and I thought, you know what, I have to go for it. And I'm incredibly fortunate to be here. I came in last June, so right in the middle of the pandemic, and there's nowhere else I would be and no other time that I'd want to be here. It's right now.
Great. That's great. Now, Laura, I know you have quite the interesting pathway story. Tell us about how you got into healthcare.
Well, my background is actually athletic training. I started I was at OSU trying to figure out what I wanted to be when I grew up, and I took a biology class and an economics class. I guess because I don't even know how to pronounce it, you know which way I went, right? So whichever one I didn't get the worst grade in, that's which way I went. So, and I love athletics. I love working with healthy people that were just injured. So it's a little bit different than a lot of health careers. And it was a fantastic way to get started. I ended up here at the agency, and I've been here over, oh wow, we're like close to 22, 23 years now. And I've been in this position for almost probably 18. So I love getting to work with my teachers, and that's how I feel that I can best help students. It's definitely not by me being in the classroom. I probably was not that great of a teacher when I was there, but I've learned a lot, and I love, and just like everyone else, I love people.
Okay. Well, now that we know where everyone's coming from, at least, I'd like to hear everyone's insights on just a variety of trends and opportunities that are available in healthcare. And let's start off with you, Patty. What is the status of healthcare workforce needs right now?
Well, post-pandemic,
Well, yeah, we're just right now.
Yeah.
I mean, today,
Right now?
life, yeah.
we need more healthcare professionals. We have shortages in every area, just like we did before the pandemic. I mean, I've worked with Jane and Laura for numbers of years trying to highlight what we knew would be coming at as baby boomers aged out, highlighting the shortages that we had 10 years ago. They have not gotten better 10 years since, despite talking as much as we can to everyone that can make a difference. So for those viewing today, as I do a lot of mentoring, I always say consider health. There are a lot of careers in the industry, but clearly we need more, we don't need less, and I don't see that letting up. I will say with the pandemic, one thing that's been a real positive of that is the growth and use of technology and looking at different ways to do things. And I think that's been very eye-opening, and I think that will change education to some degree. So that's how I see it.
Mm-hmm. The same question to you, Joe. I know that, Stillwater Medical is widely regarded as a very successful system, but what are the needs there?
I'm very much like what Patty just said. It has been crazy for my 10 months and 9 days since I've been here, just watching what's going on, because everybody in the organization, in every healthcare organization, really strap the boots on tight to get through this whole thing. And there's this period of emotional release almost now that things have kind of calmed down. And in some cases, people have just, they put a lot of themselves out there, and we have people exiting the workforce, at least for a while, to take a little bit of a break. And it's been difficult getting some people that are coming potentially out of other industries to get them to say, you know what, I'm going to move into healthcare. We have a lot of people reaching out and trying to help in a lot of different ways. So there's a lot of attention on us right now. The thing is, it's very difficult to get people to say, okay, I'm going to commit and go in there, because there's reservations about what's going to happen over the next few months, 6 months, let's say. But yeah, exactly what Patty said. We need people. We need good people that want to get in here and make a difference and have an incredibly stable career.
Jane, from the perspective of the Nurses Association, same question.
Well, I'm going to make it really short. We need more registered nurses. The nursing shortage affects hospitals, care facilities, clinics, patients, and the staff caring for those patients. Oklahoma ranks 46th in the number of registered nurses per 100,000, and that puts us at about 700 per 100,000. The national average is about 1,100 per 100,000. So you can see we're below, very much below the national average, but yet we've never been on the HRSA shortage list. And in Oklahoma, we have a pool of registered nurses and licensed practical nurses to draw from to staff our hospitals, clinics, and other nursing positions. While we do see LPNs used in hospitals, both urban and rural settings, I think it's really clear that the roles are very different, and that the LPN is limited compared to that of the registered nurse. So patient care has become increasingly more complex over the last 5 years, especially in the last year. And nurses are involved in assessing and caring for these sicker patients, employing new technology and evidence-based practices, and evaluating the outcomes of their work.
Well, Laura, I saved you to last because hopefully you'll be at least one of the solutions here. Education certainly is. Same question to you. What are the problems? What are the needs?
Well, obviously we take our cues off of industry. So what Joe and Patty and Jane say is exactly where we get our information on what it is we need to be training for. One of the things that we struggle with in Oklahoma is good workforce data. And I think my colleagues will agree with me on that. We have data that for hospitals, acute care, in much better, we have it in better grasp than we do other entities like clinics that you walk into, ambulatory care, and so on. There's a lot of other things that require healthcare professionals. And while we never want to shortchange our hospitals, we're here at Career Tech to try and provide workforce for everyone. So it's hard because, number one, we don't always know exactly. We just know there's a shortage, and we need to get, just from what those two just said, I would encourage our programs to keep fighting the fight. We know it's been difficult, but it is so needed. And the other thing that I'd like to really emphasize to students who may be watching this is your healthcare journey doesn't necessarily stop with the program you're in right now. If you're a high school student, your education experience doesn't stop there. We need you. We need you to go to Career Tech. We need you to go to community college. We need you to go and get that 4-year degree, and to keep to keep striving for the next level of education, so that all of these positions can be filled.
Okay. So Joe, you did mention the pandemic. I mean, talk about jumping in the deep end. What role does the pandemic really have in your healthcare workforce with Stillwater Medical?
Role is an interesting word. I'll kind of switch it up a little bit and maybe say impact.
Okay.
Because it is really, it was interesting to me, very interesting. The first 9 months that I was here, when this thing was really going, our people were just absolutely buckled in and focused. And we had people putting in extra time all over the place, doing anything and everything they could. I've never seen such incredible teamwork and camaraderie as I did during those times. And so it really helped build even stronger bonds. We're very fortunate here. Our people really truly focus on getting along, and since we all have that common vision of taking care of those patients and trying to have as good outcomes as we can, we came out of it with stronger bonds with the people that we work around. But it did change so much. I think maybe it was Jane that brought up the technology side of it and how much you had to learn to use those things. Today, just a few minutes ago, because of new CDC guidelines, I walked out into our little meeting area that we have in HR, and we are separate from everybody else. But I told everybody to gather around, and everybody is 8 people. And I said, guys, let's confirm everybody has had their shots. And I knew they had. So let's take our masks off. We can in these settings right now, as long as we know that everybody has been taken care of. I've got to say that was a surreal moment to do that and to think this feels strange, but it's changed all of us. There's no question about it. But I think it's really reinforced the desire to help others, because we've seen a lot over the last 9-10 months that we're never going to forget. But I do think it's reinforced everybody's desire to just jump in and help, do whatever we can to get through it.
I think taking off the mask is certainly a welcome time for all of us. Jane, did your association, did you lose members or did you gain members during the pandemic?
We actually gained members. And I would say that was twofold. One, we had just rolled out a sort of a new membership fee program that actually reduced the cost of joining the association. So that helped, but we also found that nurses were looking for resources. They were looking for support, resources, anything that they could get their hands on. And they came to ONA, they came to our national affiliate, American Nurses Association, and who also provided things. And because of that, that's where we saw this growth in membership. In fact, ANA surpassed, which has a joint membership, surpassed their membership goals for the year by the end of May. I mean, that was how great membership was.
Yeah.
So now we have to do the work to keep those members, because the needs are different. But we will continue to provide the services and the resources that we always have to nurses. So.
Mm-hmm. Well, Patty, I want to ask the same workforce question to you, but I want to add on to it. Not only, what did it do to your workforce, but are there certain positions that we're needing more of now?
Well, we beat this to death. I mean, RNs have been in short supply for a long time, and I really did like the focus on RNs. Clearly, doctors are always in short supply, but there are other areas. I mean, when you look at this whole pandemic, this wasn't just done with doctors and RNs. This was done with respiratory therapists. This was done with LPNs, nurses' aides, housekeepers, environmental service workers, medical coders, radiology, laboratory, and the list goes on and on. So it really did, people leaned into this. Even if they were scared of the virus, they knew it was part of their job, and they became part of the team. And back to something that Joe's seen, I would say in representing 119 hospitals, I've never seen more collaboration in my entire career in healthcare than what was exhibited in the last year.
Can I add on to that? Because we also saw that nurses were looking at ways to be innovative, whether it was to care for the patient, building teams with respiratory therapists, with housekeepers, to try and make sure that they could do everything they could to take care of those patients and to be able to extend the arms of the registered nurse that was in providing that care. So we saw a lot of creativity in pulling the IV pole outside, or the IV pole and the pumps outside the room, so that the IV bags could be changed outside the room without having to go inside. I mean, just the creativity and the innovations that were created are just really incredible of what all these healthcare professionals have done together.
Agreed.
Yeah. So hearing this, Laura, I want you to jump in here. Is there any new special training being required by industry?
We haven't heard of it yet, but of course, so many of the things that were inherent in the pandemic are what our core foundational knowledge that all healthcare workers have to have anyway. We all learn about how to take care of ourselves within any kind of environment where disease might be spread, as far as protective equipment and all of those kinds of resources. One thing that I personally saw, unfortunately, my mom spent a little bit of time in Joe's facility this year, and it was great, Joe. Just want you to know they did a wonderful job. But I see so much more use of telehealth for what she was actually needing. We had consults with doctors in Oklahoma City at level 1 stroke centers and things like that, that we, instead of just automatically putting someone in the helicopter and sending, I saw a lot of using telehealth. And I've heard so much more about that recently. As a matter of fact, we're getting ready to have a simulation conference. And that was one of our focuses of that's one of the topics we want to focus on, is the use of telehealth in and how that can help both simulate environments, but it's also something that it's a healthcare trend that every profession is kind of dipping their toe into, that we all need to. And especially in Oklahoma, and every state says, well, we have all these rural areas. No, people, we really do have all these rural areas in Oklahoma. And that's a great way for our critical access hospitals, and even doctors' offices, county health departments, to keep in touch with those individuals who might have a higher level of training than they have for that particular situation. So that telehealth would be my answer, but I can't wait to hear if someone else has a better one.
Yeah, and I want to open that up to everyone in industry. Is there any special training that you guys are just needing? Jane, I'm going to pick you. Go ahead and start us off. Anything that you can think of?
Yeah, I think that utilization of telehealth, because nurses used it in a way that they were able to connect their patients and their families.
Right.
And so the job of the nurse became even bigger than just caring. It became caring for all aspects of that patient. In much different ways than they have ever done before, because families weren't allowed in the hospitals. And so the only way for them to connect was on some kind of technology device, whether it was a lap, whatever it was, without trying to promote some specific name. But they were able to connect. And I'm not so sure that always that patient was an active participant in a way, because if they were on a ventilator, but it allowed the family to be there and to experience that. So yeah, telehealth is probably a big one.
Okay. Hey, and Patty, you look at it from a 30,000 foot for us.
Oh, I would agree. I mean, I was an early adopter in the 90s when telehealth was a brand new word, and it seems like it's kind of plodded along. And I absolutely believe that because of this pandemic, the acceptance by the patient and certainly by healthcare professionals I think it's a life changer. I think that it will be something that people think of to make things easier, rather than, I don't really want to do this. Let's find reasons not to do it. I think that time is now behind us, and I'm glad to see it. But I would like to follow up on something that Jane said. In working with our hospitals and their individual surge plans, it became abundantly clear that the creativity that hospitals did with staffing, of putting a critical care nurse with a nurse from maybe an ambulatory surgery area or another entirely different area, and that RN helped the other, but the critical care nurse overseeing. We saw situations where CRNAs and anesthesiologists were certainly brought in to help with airway management, with vents and that sort of thing. We saw a lot of things that in past times would be, well, that's not my role. They became part of a care team to expand and make things work better. And I think that that will, in the future, I don't think that's going to go backward. I think that it makes people more pliable and willing to try new things. And I think that's a good thing.
Anything to add, Joe, from your perspective?
Yeah, and this is going to be a little bit off the normal course of things, but through all of this, one of the things that was really important was soft skills. I mean, everybody is so incredibly stressed out. Everybody is, burning the candle at both ends. Do they understand how to manage themselves in the way that they because now more than ever, they had to show more compassion to a lot of these patients, because the patients couldn't have, family members around in most situations, in a lot of situations, I should say. So they not only had to be nurse and keeping in mind that the people that are bedside and taking care of the patients, they're always doing their best to give them a good experience. But in this case, they were the only ones that could do that. And it takes preparation, it takes training, it takes skill to really figure out how to do that, especially when you are absolutely stressed out to the max. And so I think that is an area that is really, really important, that a lot of times gets missed, because you have a lot of the fundamental skill set that they have to be in there. But it's that other side, the one that sometimes gets a little bit neglected, that really came to the forefront over the last few months.
Yeah, critical point. Great point. Fabulous point.
Can I piggyback off of what Joe just said?
Please do.
When you're talking about soft skills, you're also, and communication skills, they saw more death. These nurses saw more death than they've ever seen before. So having to be able to deal with that, it's not that nurses are, death isn't new to them, but because of the acuity of these patients and the fact that they were right there and the only one there with them when they died was truly impactful. And so also being able to understand, not only in those soft skills, but being able to understand what you needed to do to transcend that, to build the resiliency that you need to do to be able to not only take care of your patients, but take care of your family and to take care of yourself.
Yeah, because you guys all know that the people that are in healthcare, especially on the nursing side, they are used to caring for others. They don't like the ones being cared for or worried about. And so we did have to do a lot to make sure that we were telling everybody, make sure you take care of yourself. Otherwise you can't take care of them. And we know that's what you want to do. So we put a lot of effort around making sure that people were tending in themselves and working on coping skills and mechanisms and having a lot of debriefs and things like that. But yes, 100%.
Rob?
Yes, Laura, go ahead.
I was just going to say let's piggyback once again. I was just going to say that I do think that that's another area that we need to bring the focus back to in education, is how to take care of ourselves. And we have a summer, we have professional development opportunities coming up this summer, and we kind of almost have a theme going of mental health in our trainings that we're putting together, because we realize that people have been put in these positions and that healthcare workers are the worst. I don't care what anyone says, they're the worst. They will not take care of themselves. They'll be the very last ones. There's usually can be the least healthy person in the room too. Sorry, I hope my healthcare people aren't offended out there, but you know who I'm talking about. And a lot of it's because we do care so much. We don't want to take the time, and it's a skill that has to be learned. And so even though we have health maintenance practices that are in all of our curriculum, and it's still not something that anyone feels comfortable with. They don't want to well, but if I do this kind of stuff, they'll think I'm weak. And not true at all. And I also, this is going back, but I also wanted to say, with my mom being in the facility here in town, that I saw some really cool things going on about the way the workforce was. I don't know if, I'm sure Joe knows this, but they did some incentives for people to leave the floor that they're most comfortable with to go work in an area they're not that comfortable with. My mom had a fantastic nurse that was a OB nurse, and mom's a long ways past the OB, but she was this nurse was fantastic. And she said, you know, they gave us a little incentive pay to come and work in med surg so that some of these med surg nurses could go up and work in ICU. So I just wanted to throw that out there, that everyone kind of, when we talk about stepping up, there was stepping up in so many different ways.
Okay. Well, before we move on, I do want to remind our audience, we do have someone monitoring our chat today. So if you have a question, feel free, just type it in and it will do our very best to get it asked. So just go ahead and type it into the chat. Now, Laura, I want to go to this next question with you because it's really specific about education. Does Oklahoma have any unique challenges related to healthcare? And I think we probably know some of those answers. And if so, what are they, and how should education prepare for them?
I would not want to say we are unique, because I work with people from all over the United States, and like I said earlier, everyone feels like they have a rural part of their state. We may not know about New York, state. We only think of New York City, but there are rural areas everywhere in America. I do think that our geography probably does make us a little bit different, because especially when you get into like the Panhandle, there's a few critical access hospitals, but the training stops by the time we get to Woodward. There isn't any, we don't have any other technology centers. We have a few nursing programs on out in the Panhandle, but it's difficult to spread the healthcare workforce across the whole state where it's needed too. We only can do respiratory training in 3 of our technology centers, but they're needed everywhere. So, that's kind of a challenge. I'm not sure if that's, I don't know. I don't want it to sound like we are worse off than anyone else. I just think that we really need to be listening hard to what our advisory committees tell us, and to really think about doing what that doesn't just feel good for us as a teacher or as a school, but what the community really needs.
Okay. So Patty, pretty much the same question to you. Are there any, I won't use the word unique, specific challenges that Oklahoma faces?
Well, I think we do. And it's not just Oklahoma, but considering that Oklahoma is in the top 10 of typically the bad list and the bottom 10 of all the good list, when we look at health outcomes, the governor cites 46th is not good enough. I agree, it's not. But we have to look at that number, and this is not just about the patients we serve. This is also about our employees and the people that we work with every day. The health department uses a statistic that says 3, 4, 65. And it's literally that 3 behaviors in Oklahoma, tobacco use, poor diet, and sedentary lifestyle, accounts for 4 chronic conditions, and that's heart disease, cancer, diabetes, and lung disease. Those 4 conditions attributed to 65% of the deaths in Oklahoma. So when we look at it's our staffs taking care of patients that have had a lifetime of not taking care of themselves, sometimes it's our staff, our own caregivers, that are just as guilty of this. So if we're really going to improve Oklahoma's healthcare outcomes, we've got to get really serious about addressing these, because while we may be 46th in health outcomes, we're 32nd in clinical care. So it says the people taking care of them are doing a really good job, but our behaviors we rank 42nd. So we're not very compliant to take care of ourselves and do the right thing. And then I have to add in that unfortunately, this factor of 46 also has a 49th ranking in policy to deal with these. So healthcare can't do it alone. And we need to all be in this together to help our communities have strategies to promote health instead of always looking at the sickness end. I believe that Oklahoma, to move forward, we've got to be more proactive on improving health rather than just saying, oh, woe is me, there's nothing that can be done.
Policy very much is in the news these days. Joe, you have anything to add?
Well, they took the big ones, but I would tie those things together in a lot of ways with just education. And it's, very much like the numbers that Patty was just quoting, we end up on one end of either list and it tends to not be the good side. And education is kind of along the same line. That's why we're so thankful that we have the VOTEC system, the career tech out there doing what they're doing, because it really helps educate. And that's what we've got to have. We have young people out there that have an idea of where they want to go and they're focused on particular skills. And you guys are educating them, which is great. Do I wish we had, a better overall education? Do I think it would help with the lifestyle choices that people are making? Do I think it would help in some cases with what's going on with our rural communities? Yes, I absolutely do. And so really, it's just a big wheel. Everything ties together in some way, shape, or form.
Okay. So, Jane, you hit upon earlier the register versus LPN. So what should education be doing to prepare for what everyone needs?
Well, so I sort of to play off of what Joe was talking about, I think we even need to start earlier than just career tech or higher ed. I think we need a strong pre-K to 12 program, because if those students aren't prepared to do science, at least for healthcare, to do science and math, they're not going to be successful, whether they're to be a respiratory therapist, a registered nurse, an LPN, or even a physician. We have got to have a strong education system, and if you're educated, you make better decisions along the way in a number of different areas, including what you put in your mouth and whether you increase your exercise and how you take care of yourself. But from that standpoint, I think Oklahoma's really fortunate that we have multiple pathways to become, at least from my perspective, into nursing. So if you look at, whether you want to start as a CNA, you can then move up to an LPN and an RN, but also you can, and then on to an APRN. However, you can enter any of those at any point. You don't have to be a CNA to be an LPN. You don't have to be an LPN to be an RN. Although there are programs that help you do that. So if you start as an LPN, there's an LPN to RN program. If you come in the point as in a 2-year program, there is an RN to BSN program. So there are multiple entry points, and even in those 2-year, many of those 2-year and 4-year college programs have programs that are in concert with the career tech, with the technology centers, whether they're 1+1, what the 2-year colleges call a 1+1 program. There are some really unique ways to get to registered nurse. And so whether it's money, whether it is confidence, whether it is, there are no barriers. There should not be any barriers for anybody to be able to become a registered nurse or an advanced practice nurse.
Jane, I'd like to add on with that. We saw a lot in the last probably 5 years of people who are moving from military health care positions, medics especially, into nursing roles. And I know that we've worked as a state to create a framework so that people who are coming out of a particular MOS can go straight with just a little bit of coursework in OB and I can't remember the other area, but there's like 2 areas that we know we're pediatrics, that's it, that we're pretty weak on in the military, obviously. But that's it's a great way to also get into nursing or other health professions. So the more we can work with other groups to help eliminate barriers, that only helps every one of us.
And Laura, let's just kind of keep in that same vein. If you were addressing a young person today, or perhaps someone that's just wanting a career change, what kind of information would you give them about healthcare options, Laura?
Rob, I tell everyone this is going to be my next career. So I love career counseling when it comes to health. No, seriously, there is something for everyone. And it's so important that every healthcare profession is valued. One of the things that not having a registered nurse in this position at the agency has done is it's allowed me to say, you know what, we don't have to be this or that. We all have a common background. And then on top of that, we all have very individual experiences that everyone can learn from. There's nothing that is one's better than the other. So it's a great thing to be in tune with. ICAP is something that our agency has invested a lot of time and attention on, trying to come up with a strategy for every student to have a plan, to know what they're going to do, and to provide some kind of career investment or career tool that will explain what are these different careers, what are my options. I only want to go to school 2 years, so what are my options? And I think the more we can share about different careers, what interests and aptitudes might lead to that kind of career, the more people will get not only into healthcare, but they will be in the right spot. I know my coworker's on here with me right now too, and she started the same as I did as an athletic trainer and ended up in respiratory care. But that wasn't after she'd done a little stint in nursing and said, nope, that's not the one for me. So it's so important to know that whatever your mama thinks you have to be, that's not what you have to be. You can be there's over 200 healthcare professions. So, and they're all needed. So it's just more a matter of finding out who you are and what skills you have that align to what's needed.
I'm interested in what industry has to say on this. If someone's wanting a healthcare career change, I want to hear it.
I'm ready to go. First off, it's never too late to learn something, as someone else said. I mean, I went back and got another degree and graduated in 18, and I was the oldest person in my class, but I was undaunted because I had way more experience. But I would like to say, we typically think you've got to be good in math and science to get a healthcare job. And that's important, certainly, if you want to be a doctor or a nurse or one of those types of fields. But when I talk to students, it's like I really hear the ones going, I can't do blood and guts. I can't do needles. I can't do that kind of stuff. It's just as important that healthcare has good writers and good spellers. There are all sorts of jobs that support the healthcare professionals in the hospitals, whether that's in coding, whether that's in compliance, whether that's in Joe's area of HR. There are all the undergirding of professional people that are needed with a skill set. And I just always say, if you're unemployed with a healthcare background, clearly it's by choice, because there's always job opportunities out there. And I mean that sincerely. I have pushed every niece and nephew and their friends to say, look at healthcare. It doesn't have to be a nurse. It doesn't have to be a doctor. It could be a medical technologist. It could be a radiology technologist. It could be any number of things. And so I really push strongly on that.
It could even be an epidemiologist.
Yeah.
Health has a huge need
Right.
for that. And epidemiologists can be in hospitals and they can be in public health. So I think, you know, I think it's one of the most diverse professional areas that you can pick because you've got different kinds of settings that you can pick. You've got different specialty areas. I mean, and I say that always about nursing, but I think when you're looking at the whole you know, all of healthcare, the continuum of healthcare, it's extremely diverse. I mean, I mean, if you look at the four of us on this panel, none of us were nurses to start out with, or physicians. We weren't, you know, pre-medicine. We weren't physical therapists. Well, although Laura, you were really close.
Don't tell my mom that.
Well,
She still yells at me.
hey, I was a fashion design major. What can you say? You know, it sometimes it doesn't matter what you get your degree in. It's
Right.
what you choose to do with the skills that you were given. And I saw somebody had something about character issues. I mean, character is important. It's hard to teach in school. It's taught at home as well. So it is, you know, making ethical career character choices are important.
Jane,
Yeah.
I love that you said epidemiology because if you're not a good speller, you can't spell that word.
I can't spell it, and I don't think it comes up in when you try to misspell it, and you can't tell whether you're getting the right spelling or not either.
So Joe, you're in a college town. You know, any special challenges there with, you know, trying to in recruitment?
Special challenges. You know, I don't know. I wouldn't necessarily say that there's any special challenges that we have. We work with OSU a lot in a lot of different areas on different projects. We have a lot of the kids that come in here and volunteer their time. We've started a couple of programs with them to basically have some paid internships for those seniors, so we can kind of get a fresh look at them and what would you say, on the job training, in a manner of speaking, because if they like us and we like them, they're ready to go when the time comes around. It's a really good place to be because when we have needs, we can reach out to the school, and I can guarantee you they're going to have people come over and help us out. It was absolutely, it was amazing the way they responded to the hospital whenever we were having issues with, you know, PPE in the very beginning and what they were trying to do to help us out. It was, it's definitely a partnership. I want to jump back into the previous question just a little bit, because we all think the same thing, that there's a lot of meaningful work. There are a lot of good jobs to be had in healthcare. There's a lot of room. I think given what we've been through and what we're not out of yet, the fact that these are stable jobs in stable industries is huge. And in a lot of cases, the benefits that you're going to get working for a healthcare organization are superior to what you're going to find in other areas. If you want to have good healthcare at any point in time in my 57 years of life, it's right now. I want to make sure that I am covered and my job is stable, because I know a lot of people that were laid off, or their hours were cut back dramatically, or the businesses shut down. And I can promise you, all we were doing was looking for more people. And so stability of the job and the benefits associated, I think, are a huge thing that really need to be looked at. It's a little bit easier for somebody at my point in my career to really appreciate those. But for the younger people that are just coming up through, I hope they spend some time and really think about that, because it's a huge piece of it.
Well, we've just got about 12 minutes left in our conversation, but I do have a couple questions I want to get out here. And Laura was so kind to send us several questions. And this is one I'm pretty sure you want to answer, Laura. Tell me about new projects or initiatives your organization has promoted during the past 2 years. So, Laura.
Okay. Well, let's see. One of the things you started off the session with a big thank you to the Masonic Charity Foundation. We've had the Nurse Refresher Program available for the the Board of Nursing for years, and it has just recently we were able to connect with the Masonic Charity Foundation. They said, we have some money. Wow. And in education, you don't hear that very much. So when someone says, we got the money, we listened. And they said that they wanted to give us $200,000 to distribute across our schools that were offering RN and LPN refresher courses, which would allow those people who have let their license lapse or were not able to sit for their board exams after they took their coursework. And so it gives them another opportunity. So that has been fantastic. We have 70, I looked it up just today, 73 people. So we have just a little bit over 25 scholarships left that we can hand out, and it's for a free $2,000 value nurse refresher course. So anyone who's out there that's interested in that, I'd love to tell them about that opportunity. And as far as I think as far as other big initiatives, we've been just trying to come up with resources and things that would help our teachers pretty much over the last couple of years. Hunker down, here's some free curriculum, here's something you can use this lesson in your class tomorrow, or whatever we could come up with. I do want, sorry Rob, but I can see the chat, and I do want to address this person's question about character issues. I'm new to healthcare and a long-term care administrator. I've noticed we have more character issues than we have math and science issues with employees. Is there anything being done in education to address those issues? I fire people due to poor character 8-1 over them not being book or skill smart. Amen. Whoever said that, I just want you to know, we feel you, we know you. My teachers are nodding their heads right now that are on this broadcast. You can see them, and they're saying, I swear to you, we're teaching it. I promise you, we're teaching it. So much of that value and the character things come back around, that it is a lifelong skill that we're many times getting students who haven't ever been exposed to the right way to address another professional in their organization, or how to be on time, or how to, all of those kinds of things, those character kinds of things. We do understand that, and I promise we're working hard. I would like to say to administrators, and when I say administrators, I mean school administration, when your teachers say, you know what, they would never let us have this many absences in real live work, support them. If the student is not going to come to class, you can't keep them there, because that's exactly what's going to happen. We're going to make workforce really unhappy with us when we keep putting people out that aren't well trained in all those areas. So I'm sorry, I kind of got off topic, Rob, but I wanted to address that too.
Glad you did. Glad you did. Does anyone else have anything to add into this? Because I do have one more. Okay, Joe.
Joe, pick me.
Oh, and Jane. All right, everybody.
Hey, Jane, why don't you go ahead and start?
You talked about what initiatives new projects we had going. So ONA has been the convener of a group called the Oklahoma Academic Clinical Nurse Partnership. And that has been a group of nursing faculty that are run from LPN, RN, all and high, so it all ranges of RNs. So that's been really exciting, along with CNO. And in that, we've had a lot of sharing and a lot of work being done within that group to update the nurse refresher program, and then also sharing materials and resources to allow all nursing programs so that they could replicate what's called a nursing student clinical partnership. that would allow nursing students to get clinical time and be paid for it at the hospital. And the hospitals then to make sure that the clinical experience those nurses were getting was also met the curriculum requirements. And then they were also able to employ those nurses after that to give them really good experience and experience what it was like to work at that particular facility. So that, I mean, that was a huge piece of the work that we did, along with other innovations that one hospital had put in place to share it with another, and then really working on an ask for the governor to get more nurses into the state and to pay them. I know that there's a question about salary, but we had hospitals who were facing competition from Texas for travel nurses at $150 per hour. It's not that anymore, so don't think you can jump in and be a travel, if you're a nurse, that you can jump in and be a travel nurse and make $150 an hour. But at the height of the pandemic, that's what some of those travel nurses were making. So that was sort of the kinds of things we were help convening and leading through this process, through this pandemic release. And that group is continuing to meet and look at other kinds of ways that they can work collaboratively together.
Joe, go ahead.
Yeah, I want to jump back in on the question that Laura was answering on the character.
Yeah,
We were just having conversations about this a little bit earlier because we've been doing some training on how to do the evaluations, how to do write-ups and things like that. And in reality, our focus needs to be on that front end. And the front end being, how are we interviewing them? How are we checking them before they ever get into the organization? Once they get into the organization, are we orienting them well? Do we put them with a leader that is a skilled leader? And I'm not saying any leader doesn't have some skill, but do they have the skills to actually coach and mentor someone through? There's no way everyone is going to make it. You are going to have some character issues. But in a lot of cases, what I've seen, I'm talking about everywhere throughout my career, if you don't have good leadership in there to model for these other people how they should carry themselves, how they should interact with other people, how they should, what time do they show up for work? What time do they leave? All those basic things. You don't have someone modeling that for them. It's really difficult because they bring in what they've learned throughout their life. And in a lot of cases, it's not enough for the particular workplace at that particular time. So I think it's leadership training in the organizations right now. It's making sure that the leaders can actually lead as opposed to just manage.
Now, I'm going to stop watching the clock because I do want to get my last question. I've been asking this as long as I've been asking questions. And I want each of you to answer this one for me. What advice would you give the 16-year-old you to know what you know now? So throw out some wisdom here for us. Jane, can I start with you?
You sure can. It's find your passion and do what you love. Don't worry about whether you have the degree or not, but just do what you love.
Patty?
Well, I have to tell this story. I went to high school in a small town in southwest Oklahoma that I love. The guidance counselor was also the basketball coach, and I didn't play basketball. So my only encounter was after my ACT scores came back, and he looked at all of my scores and he said, wow, you have an aptitude for taking things apart and putting things together. You should consider auto body at the Career Tech. And I said, well, I want to be an architect and I want to go to OU. And he said, I don't even have a course book for OU. You'll have to mail them yourself. Long story short, if I knew what I knew today and it had the wisdom of someone helping me, I would have gone to medical school, because now I get that I was good in math and science. And I mean, like I said, I lucked into healthcare and I've loved every job. But I am so energized by working around smart people that do such amazing things that I'm like, what could be a better career than this? I just love it. But yeah, I would have gone to medical school, but I'm darn pleased to be in the role that I am. Never thought I would be in a position like this. So you never know what a kid from a country school, where they can go and where they can end up.
You know, Casey Shrum tells the exact same story. If it wasn't for an instructor that said, you know, you can do this. And she said she had never even thought about it until.
Right.
Yeah. So Laura, fill out some wisdom for us.
I'm not sure I have any on this topic. Let's everyone get out their checkbooks, and whoever is the lowest, then they don't get to answer this question. Hey, see, I think I'm getting out of it right now. Sorry, my boss is probably listening, and she's probably not very happy with me right now. It was just a joke. I would honestly say that I've learned that the most important thing is meeting people and making relationships. It'd be great if we all were paid what we deserved just based on our knowledge or our skill set or whatever, but you get so much out of your career that comes from the intangibles, and the people are many times the intangible. So I know I could do a lot of other things where I might have been a physician and made my mom happy, but unfortunately for her and fortunately for me, I get to work with teachers. I get to work with other people who want to make a difference in students' lives, and also who want to make a difference in people's lives. So I love the healthcare aspect too. It's not just education, it's healthcare and education. And to me, that's the best of both worlds.
Joe, wrap us up with the best advice to the 16-year-old you.
Well, knowing what I know now, what I would tell the 16-year-old me is get into Stillwater Medical early and stay. And, you know, I'm not kidding, because
this is a great boss.
Yes, it is an amazing place to work. I mean, healthcare is an amazing industry. But in all seriousness, if I was to look back, I would tell a 16-year-old the same thing I told my sons who are just getting into their careers. They've just started, literally, both of them within the last year. And I just tell them, guys, every day is a working interview. You say that from day one, you say that till the day you retire. Every day is a working interview. When you wake up, you think it. When you go home, you ask yourself, if I was paying me for my job, or if I was to hire me, would I hire me based on what I did today? Yes or no? And if the answer is no, you better get your head up and get it figured out. Because most of the time you're your harshest critic, which is, I think, can be a good thing. But you have got to know that every single day you are getting paid to do a job. Get in there and do your best. If you want to rise up through an organization, that's how you're going to do it.
All right. We thank you very much for your insights. We very much appreciate each of our panelists taking part in our series of panel discussions on industry trends and employment opportunities. Also want to thank once again the Masonic Charity Foundation of Oklahoma for their very generous donation to the Nurse Refresher course. And for our viewers, whether you're watching this live or later, if anything we said today sparked any interest, do not hesitate to contact me or any of our panelists. And if we do not know the answer, I am sure we can find someone who does. Also, you can look for this entire discussion on our Oklahoma Career Tech YouTube channel in the coming days. Everyone, have a great afternoon. Thanks for watching.
Thanks, Rob.